What if the way you've been taking care of yourself for decades is now quietly working against you? I'm not talking about anything dramatic or dangerous. I'm talking about something deeply personal, the kind of private habit that no one teaches you to update as you age. For most men, the techniques that felt natural in their 30s and 40s became second nature, fast, firm, focused on a single goal. And yet, after 60, your body has changed in ways you may not have noticed until things started feeling different. Here's the truth: that change is not a sign of weakness. It's not losing your manhood. It's biology. Hormones shift, blood vessels age, nerve endings grow quieter. And if you keep treating your body the way you did decades ago, you might be unknowingly creating more discomfort, frustration, and even long-term harm than you realize. I'm Dr. Michael Moore, a board-certified urologist with over 25 years of experience helping men in their 60s, 70s, and beyond maintain healthy, confident, and safe intimate lives. I've worked with thousands of patients who thought they were broken, only to discover that a few simple adjustments could restore comfort, improve sensitivity, and bring back a sense of connection they thought was gone forever. And since you're already here with me, I'd like you to stay until the very end of this video. I'm going to share practical, science-backed steps that have worked for many men just like you, steps that can help you feel more at ease, more responsive, and more confident again. If this is something that matters to you, let me know by typing 1 in the comments, or share what you've been wondering about. I read every single comment and your story matters here. And while you're at it, consider subscribing so you won't miss the next tip or insight that could make a real difference in your life. Your body is evolving, and it's time your approach evolved with it. After 60, many men start noticing changes they can't quite explain. What once felt immediate and effortless may now take longer to build, and the sensations may feel different. Part of this is hormonal. Testosterone, the key hormone driving libido, mood, and sexual performance, naturally declines with age. In fact, research in the Journal of Clinical Endocrinology and Metabolism shows that testosterone drops by about 1% per year after the age of 40. By the time you reach your mid-60s, that can mean a significant shift in how often desire appears spontaneously and how strongly your body responds when it does. Blood flow plays another crucial role. According to Harvard Health, the small blood vessels that feed the pelvic region, especially those supplying the penis, lose elasticity over time. Just like arteries in the heart, these vessels can stiffen and narrow, making it harder for blood to flow in quickly and stay there. This is why erections may take longer to achieve and can be more challenging to maintain, particularly when you're alone and in a relaxed state. Then there's the nervous system, which is often overlooked. The nerve fibers that carry sensation from the skin to the brain are coated in a protective sheath called myelin. Over decades, that myelin layer can thin, slowing the speed of nerve impulses. It's a bit like switching from high-speed internet to a slower connection. The message still arrives, but not as instantly. This means touches that once sparked immediate reaction might now require more time, varied pressure, or different types of stimulation to be fully appreciated. Think of it like physical training. At 30, you might have been able to sprint without warming up. At 60 or 70, even elite athletes adapt their workouts to protect their joints, maintain endurance, and prevent injury. The same principle applies here. Your sexual system, hormones, blood vessels, and nerves needs adapted training too, a gentler, more responsive approach that works with the body you have today. I remember a patient named Richard, a 68-year-old retired engineer, who came to see me convinced he had erectile dysfunction. He was frustrated and embarrassed, saying, "It just doesn't work like it used to, doc." After a thorough checkup, we found no major vascular or hormonal issues. The real problem was that he was using the same fast, firm technique he had relied on for decades. We made a few adjustments, slowing his pace, changing his position to improve pelvic blood flow, and adding a longer warm-up phase. Within a month, Richard reported that not only had his erections improved, but the sensations felt richer and more satisfying. These changes are not signs of loss, they are signs of evolution. Understanding what's happening inside your body is the first step toward adapting in a way that restores pleasure, comfort, and confidence. And once you know the science, you can start making choices that support it, rather than fighting against it. One of the biggest challenges I see in my clinic is that men over 60 often carry their old habits into a body that no longer responds in the same way. The first mistake is holding on too tightly. In your younger years, a firm grip might have added intensity, but after 60, thinner skin and more fragile blood vessels make that same pressure risky. I've treated men who develop tiny micro-tears in the skin from repeated strong grip, leading to redness, irritation, and in some cases long-term reduction in sensitivity. Loosening your hold isn't about losing control, it's about giving your nerves and blood vessels a chance to work at their best. The second mistake is starting too fast. Your nervous system now needs more time to tune in to stimulation, and rapid motion can overwhelm the signal rather than enhance it. I once had a patient who described his experience as pressing the fast-forward button on a song you want to enjoy. The pleasure was there, but he was skipping over it. Slower, more rhythmic motion allows your brain to register and savor each sensation, rather than rushing past it. The third mistake is skipping lubrication. Many men still think lube is for women or for partnered intimacy only, but as testosterone decreases, natural lubrication does too. A study in the British Journal of Urology International found that prolonged dry friction increases the risk of microabrasions and inflammation, which can dull sensation over time. I've seen cases where dryness led to persistent discomfort for weeks. Using a gentle, unscented lubricant early not only protects the skin, but also allows the nervous system to interpret touch as pleasant rather than irritating. The fourth mistake is forcing a climax. After 60, arousal may come in waves and reaching orgasm might take longer. That's normal. Pushing hard to get there can trigger stress hormones like cortisol, which work against arousal. One patient told me he would leave a session feeling tense and disappointed until he learned to focus on enjoyment rather than the finish line. Letting go of the stopwatch often leads to deeper, more satisfying experiences. The fifth mistake is ignoring your body's signals. Years of routine can put you on autopilot, but self-touch after 60 should be about response, not repetition. If something feels dull, change it. If something feels unexpectedly good, stay with it. There's also a sixth mistake I see often: neglecting overall health. Conditions like high blood pressure, diabetes, or the side effects of certain medications can directly impact blood flow and nerve sensitivity. Addressing these with your doctor is as important as technique. The lesson here is simple. After 60, pleasure is a game of quality, not quantity. By listening to your body, protecting your skin and nerves, and respecting the changes in your system, you can rediscover sensations that are richer and more rewarding than anything you experienced rushing through in the past. A good routine starts with giving yourself the right amount of time. Set aside at least 15 to 20 minutes where you won't be interrupted. This isn't just for privacy. It allows your nervous system to shift out of alert mode and into a relaxed state where arousal can build naturally. Choosing the right environment matters too. Soft lighting, gentle background music, and a comfortable temperature signal to your brain that you're safe. That feeling of safety is what allows your body to release tension and focus on sensation. Before any touch, start with slow, deep breaths in through your nose, out through your mouth. This isn't just for relaxation. Deep breathing increases nitric oxide in your blood, which helps dilate blood vessels and improve circulation to the pelvic area. I often suggest adding a brief warm-up for the pelvic muscles, such as light stretching or a few gentle Kegel exercises, to get the blood flowing and prepare the tissues for stimulation. When it comes to lubrication, apply it early. Don't wait until you're fully aroused. Early application softens the skin and sends a signal to your nervous system that touch is pleasurable. For most men, a water-based lubricant is a safe choice because it's easy to clean and works well with sensitive skin. Silicone-based lubricants last longer but can be harder to wash off and may react with certain materials, so test on a small patch of skin first if you're unsure. Avoid heavily scented or warming gels if you have a history of irritation. As you begin touching, think of it as exploration, not a race. Avoid going straight to the most sensitive area. Try sensory mapping, slowly moving your hand over different areas of the genital and inner thigh region, noticing where sensation feels sharper or more pleasant. Over the years, some nerve pathways may have become less responsive, while others might surprise you with how alive they still are. By mapping them out, you can build a more rewarding routine. Pause when you need to. If arousal dips, let it. Sometimes stepping back for 30 seconds, keeping your breathing steady, and resuming slowly can actually bring stronger sensations. Throughout, keep your breath relaxed and rhythmic to maintain healthy blood flow and keep your mind anchored in the moment. I think of James, a 72-year-old patient who came to me feeling disconnected from his body. We worked through this gentle touch blueprint together, adding the breathing, the warm-up, the sensory mapping. After just 3 weeks, James reported not only better circulation and stronger responses, but also deeper, more restful sleep. He said the biggest change was learning to treat this time as care for himself, not just a goal to achieve. That shift, more than anything, is what made the difference. Comfort is more than a luxury. It's a foundation for better sensation and safer self-care after 60. The positions you choose can make a huge difference in how your body responds. Lying on your back with a pillow under your knees, reclining in a supportive chair, or lying on your side with hips slightly elevated can all reduce strain on your lower back and improve blood flow. From a medical perspective, these positions help relieve pressure on the pelvic veins and the pudendal nerve, the main sensory nerve of the genital area. Less compression means better circulation, less numbness, and a richer range of sensations. Some men also find benefit in using aids like warming sleeves or soft textured covers. Warmth naturally relaxes smooth muscle in the blood vessel walls, allowing more blood to enter and stay in the erectile tissue. Textured materials can add variety to nerve stimulation without requiring excessive pressure. If you explore these options, look for products that are FDA approved for intimate use. Medical-grade silicone, non-porous materials, and non-toxic lubricants are safest. Be cautious with cheap, unregulated items that may cause irritation or allergic reactions. Equally important is your mindset. Many men have spent a lifetime measuring success by performance, speed, stamina, climax, but after 60, the greater reward comes from presence. Presence over performance means focusing on what you feel moment to moment without judging yourself against the past. It's about noticing the warmth of your hands, the subtle changes in pressure, and the way your breath syncs with your movements. This mental shift reduces anxiety, calms the nervous system, and allows your body to respond more fully. You can enhance this by incorporating mindfulness, deep breathing, and gentle self-massage into your routine. Mindfulness keeps your attention anchored in the present. Slow, steady breathing increases oxygen delivery and balances the autonomic nervous system, which regulates arousal. Light self-massage of the inner thighs, lower abdomen, or even the feet before starting can release tension, raise dopamine levels for anticipation, and boost oxytocin for a sense of comfort and connection. I recall working with a patient in his late 60s who had avoided self-care for years due to embarrassment. He carried a heavy sense of shame, believing his changing responses meant something was wrong with him. Together, we worked on changing his environment, trying new positions, and most importantly, reframing his mindset from one of performance anxiety to simple presence. Within a month, he reported not only improved physical responses, but also a lighter mood and better connection with his partner. The moment he stopped judging himself and started focusing on enjoying the experience, everything began to work better. Your body responds best when it feels safe, supported, and unhurried. By choosing positions that protect your circulation and nerves, using safe, quality tools, and shifting your mindset toward presence, you create the perfect conditions for your body to give back what you're looking for. As you learn to adapt your self-care routine, It's equally important to know when to bring a professional into the conversation. There are certain signs that shouldn't be ignored, no matter how private the topic feels. Persistent pain or discomfort during or after self-touch is one of them. If you notice a burning sensation, irritation, or soreness that doesn't improve with lubrication or gentler technique, it could indicate inflammation, a minor infection, or tissue damage that needs treatment. Another red flag is sudden or significant loss of sensation. While gradual changes in sensitivity can be part of aging, a sharp drop or a dead zone in feeling may suggest a nerve-related issue that responds best when caught early. Inability to achieve or maintain an erection even in calm, private settings is also worth checking. This isn't a judgment on your masculinity. It can be a vascular or hormonal concern that may benefit from medical support. And lastly, emotional distress linked to self-care, whether it's frustration, anxiety, or shame, can create a cycle that affects both your mood and your physical responses. Addressing it openly with a healthcare provider can be the first step toward relief. Beyond these, there are other symptoms you should take seriously. Changes in urination patterns, such as increased urgency, weak flow, or nighttime frequency, may point to prostate or bladder issues. Blood in the semen, while often benign, should always be evaluated to rule out infection or other conditions. Unexplained swelling in the genital or pelvic area can also signal a problem that deserves timely attention. If you do decide to see a doctor, going in prepared will help you get the most out of your visit. Keep a simple symptom diary. Note when issues occur, how long they last, what seems to trigger or relieve them. Bring a list of medications and supplements you're currently taking, since many can affect blood flow, nerve function, or hormone balance. This gives your doctor a clear picture and helps them tailor solutions to your specific situation. Remember, your body is not broken. It is evolving, and your approach should evolve with it. Adapting isn't about giving up. It's about working with the body you have now to create the best possible experience, physically and emotionally. So, I'd like to hear from you. Which of today's tips will you try first? Drop your thoughts in the comments. And if you found this helpful, share it with a friend or partner who might be going through similar changes. Subscribe to this channel and turn on notifications so you won't miss our next video, where we'll explore the connection between self-care habits and long-term prostate health. Your journey to better confidence and comfort is just beginning, and I'm here to guide you every step of the way.